So like those are things when you're talking about looking at that first job interview, looking at your value as an employed clinician versus somebody else's value. Have we
Mhm.
talked about any of that yet?
No.
Okay, so let's have this conversation. Let's pretend you're looking for your job, right?
Mhm.
You tell me, and I don't expect you to have a good answer, and that's fine. Why do I hire you versus somebody else in your class?
Um, because I provide um, better patient care with more 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 patient satisfaction with me because of who I am and how I provide care.
Okay, so think of, and don't say names, think of the least, um, whoever's in the lowest 5% of your class, academically, performance wise, right?
Mhm.
Do you think that person isn't going to say exactly the same thing? Do you think they're going to come in and say, you know what? I'm in the bottom 5% of my class. I am a horrible student and a terrible therapist. I'm probably going to make patients quit coming to therapy, but definitely hire me, right? No, they're going to say exactly what you just said.
Right,
And they probably believe it, and that they have to. Like if they didn't believe it, there'd be other problems.
right.
So you want to establish before you ever go out on an interview, okay, what's really the unique selling proposition that I deliver? What is unique to me? And then do I fully understand the problems of the employer who's looking to hire somebody?
Mhm.
Because just like a patient comes in with shoulder pain, it might be neck, it might be thoracic, it might be elbow. You have to understand the root cause of what's going on.
Right.
So with an employer, you have to understand what are they really looking for. If I'm going into a small practice like mine,
Mhm.
I know the number one priority isn't revenue and profitability. The number one priority for a small practice like mine is don't be a pain in the butt. Don't cause more problems for me, the owner. Don't
Right,
cause conflict and don't bring like personal issues to work.
right.
That's what I care about more than profitability or anything else. If you're going to a hospital, a large organization, they're going to have different priorities. You have to understand those priorities before you walk in the door. So,
Mhm.
like when you come to see me, I'm looking for a happy, satisfied person. I can never make you happy. I can't improve your quality of life. You have to come bringing that stuff with you already. And you have
Right.
to show that to me that you are genuinely happy. You're not faking it.
Okay.
Then I want you to understand the profitability issue. So, like, here are two scenarios, because I know our patient's going to come in shortly. Here are two scenarios that nobody ever talks about, but they absolutely should. So, a typical 40-hour work week,
Mhm.
you're usually going to arrive 15 minutes before the first patient.
Mhm.
That's 15 minutes of non-billable time, but you're going to be clocked in because you're going to be getting ready for the day and getting your charts and all that stuff right.
Mhm.
You're usually going to finish your last session on the day about 15 minutes before you clock out. So we've got 30 minutes of non-productive time. Not counting, most people will get 30 minutes of paid lunch and then 30 minutes of non-paid lunch. So technically, you've got an hour in the day. You're getting paid a full therapist rate, but you're not producing any units for reimbursement.
Mhm.
If you're working 5 days, you're looking at 5 hours of paid time that you're not producing anything, right? If we look at a 50-week work, 50 weeks a year of work, now we're looking at 250 hours of
Wow.
paid time, right? Think about that. If we did a little bit of math, we're looking at $15,000 that you're being paid and you're
Wow.
not producing anything from a profit perspective. So you could walk in and just say, you go through it and then you talk about that and you say, hey, Tony, I realize most of your employees are probably clocking in 15 minutes before, clocking out 15 minutes after, taking a 30-minute paid lunch. Um, I understand at $100 reimbursement, that's about $15,000 a year. So part of what I'm bringing to the organization is at least acknowledgement of that. And what I'm willing to do is take the sacrifice, clock in when I'm ready to start treatment, clock out when my treatments are finished, use that 30 minutes of paid lunchtime to, whatever, do an extra unit, this or that. I think I can reduce that 15,000 a year in lost revenue to at least 7,500, right? And so that represents a savings to the company. I would love the opportunity to see some of that savings come back to me in the form of a bonus. I'm not asking for it in my hourly rate, but maybe think of it from a bonus perspective. Totally reasonable, totally on the table. Another part that nobody talks about. So you walk in and you say, I understand, because I had this amazing CI and he explained to me the biggest loss in revenue is cancellations and no-shows, right? So what is your typical cancellation no-show rate right now? And they're probably going to say like 10%. That's pretty typical. Okay, so what does that reflect? Well, if you're seeing 10 patients in a day, 9 of them arrive, you get 1 cancellation a day. Not unreal, right? 1 cancellation a day represents the same $15,000 a year at $100 reimbursement as the hour of non-productive time. So now you're saying, I think I can reduce your cancellation no-show rate by even 25%, right? What does that mean? That means that I'm saving the company somewhere around $4,000 a year. You combine those two components. You say, look, you're paying 15,000 a year in non-productive time, and you're losing 15,000 a year in no-show cancellations. That's 30,000 a year. I think I can make a sizable impact on those two numbers. That's why I want to negotiate a salary or negotiate a bonus system that if your base rate, you're paying new grad physical therapists $75,000, I'd like to be eligible for 80. And this is why, and I understand that this is the responsibility is on me to make this happen. You're already losing that $30,000 a year anyway. So let's assess this on a quarterly basis. And by the end of the year, this is what we can agree to. Like nobody has ever walked in my door and said those kinds of things. Always the cat and mouse. It's always, I'm the employer, you're the potential employee. I'm not going to tell you what I'm willing to pay. You have to throw the number out first. I'm going to sit back and wait, and you're thinking the same thing, and you're trying to figure out what I want to hear, and I'm trying to figure out what you're trying to do. And it's this weird dynamic. It's like, look, pretend it's a patient interaction. You, Mr. Employer, tell me what your problem is, and I'll tell you if I can solve it, right? You have office politics. People are dating each other. People are fighting. I don't want any part of that. I can't solve that problem. I'm going to go apply for another job. As profitable as you'd like to be, and you see that there are these gaps in the system, I can handle that. Know exactly how to do it, how to fix it, and these are the objective measures that we're going to use to rate performance. Like those are insane qualities that put you head and shoulders above anybody in your class. You could be in the bottom 5% of your class. Conversations, you're going to be hired in 3 seconds at a premium rate. So those are things that I always try to tell you guys as students to think about, to look at, to investigate, get a sense for the company culture, get a sense for what's important to whoever's making the hiring decision, and then start building your network. Just like I told you, if you know you want to work in San Diego, you should be looking at all the clinics around the geography you want to work with. You should be finding ways to make contact with therapists that are in those organizations, doing anything to build your professional network right now. So when you do graduate, when you do get credentialed or licensed, you're ready to start working. And then that brings me back to the Medicare contract. Did we talk about that in terms of if you have a contract and your peer from school doesn't? Did we talk about that?
No.
So even something as simple as that.